Hello there. I am Jay Cohen, Senior Trainer for Tekscan's Dental Division. I'd like to start by thanking you for joining the session today. Today's session is about excursions. As you all know, excursions are a complex subject, and I could talk about it for hours. But due to time constraints, I'll be focusing on the basics for recording and reviewing occlusion with the Tekscan. There are many philosophies in dentistry. Some suggest an anterior guidance occlusion. Others prefer group function occlusion, to name a few. At Tekscan, we like to say that as a dental device manufacturer, we are non-denominational when it comes to occlusal philosophy. Tekscan does not promote any one philosophy. Rather, we provide a tool that allows you to see the occlusion and apply your own theories. Regardless of your philosophy, if you do follow any, the goal for today's webinar is to present the features and functions of the Tekscan that allow you to see and treat the occlusion dynamically, unlike static methods like articulation paper and waxes. And just to mention a little thing about papers and waxes, then we don't eliminate or replace articulating papers. They're complementary products. We still use articulating paper, but we use it for really what it's meant to do, and that is just to mark teeth. It's a static means for marking teeth, and it doesn't give us any dynamic information, relative force or timing. This presentation will be framed through the anterior guidance philosophy, made popular by the late Dr. Pete Dawson, known to many as the grandfather of occlusal analysis. Before we begin, I have a couple of brief comments. Feel free to ask questions. I'm sure you are all familiar with Zoom by now. You can type your question into the Q&A box. We will attempt to answer all questions at the end of the session. If we do not get the opportunity to answer your question, we will contact you directly after the session. Also, if you experience any audio issues, you can also dial in directly instead of using your computer audio. Phone numbers are listed in your webinar invitation. So let's get started. So let's talk about how to record excursions. So the first thing I would recommend when recording an excursion is to adjust your sensitivity. I would increase it a little bit. So after you've adjusted the sensitivity, you've gone through that process and you're taking some just regular scans. When you want to adjust when you want to take excursions, you want to increase the sensitivity a little bit, make it a little bit more sensitive. So I suggest you go up 1 or 2 levels from the setting that you were at previously. Okay. Also, you want to set expectations. This is really important. You want to ask the patient to demonstrate or practice an excursion without the sensor in their mouth. Okay. So you want to have the patient show you an excursion, bite, slide, open. And when you're convinced that they are doing it correctly, then you're ready to scan their bite. Okay. So then you're going to go ahead and record a lateral excursion. And you want to ask, it's very important that you coach the patient through the process. We're not just going to say bite, slide, and open, or do a left lateral excursion. So you want to walk the patient through, and you might suggest that to the patient that they follow your commands. Okay, and you'll tell them when to bite, when to slide, and when to open. So for example, you might just say bite hard, and I would pause because you want them to clench and hold for a moment, half a second, but you do want to pause when they're biting and clenching. Then slide right, open. So again, I would say bite hard, slide right, open. You can hear the cadence in my voice, and they'll follow that. And that will tend to give us better data. All right. And it's, you can use intuitive commands, like you might say grind to the right, because the patient may not understand slide to the right or move to the right or to the left. So grind to the right. Some people say rub your teeth to the right. But again, you just want to rehearse so that the patient is doing the right thing before you begin to take the scan. Okay. And just a note, you want to record a movie, a new movie for each excursion. Okay, so you want to separate a left lateral excursion from a right lateral excursion, for example. Some people do what they call the all-in-one scan, where they bite, slide, open, then they bite, slide, open the opposite way. But we feel that you'll be able to manage the data better if you just to record a single excursion. So you'd have the patient bite, slide to the right, open, and once they open, stop the scan, and then you can save it, and then go to the next scan and do the left lateral, for example. Okay, and I'll demonstrate that for you momentarily. Okay, so let's do that. Let me switch over to the Tekscan software right here and share. Great. Okay, so we're at the patient list, and you can see a list of patients in the group. There's my name right there, Jay Cohen. You see some scans that I have previously taken, but I'm going to go to new scan, and we're going to look at that. Okay, so just a few things, and also let me turn on the camera so you can see me. Hello out there. Okay, good. So we have the Tekscans all set up. I've already set up the handpiece with the sensor and the support. And just a kind of a note about that while we're on it. So I have a large sensor and a large support. Okay. Now, the difference between the large and small support, it's not that great. And some people can use either, which I am one of those patients. I have a narrow arch. But my mouth is big enough that it can accommodate a larger sensor without interfering with my bite at all. So there are going to be those who could go either way. If that's the case, I would suggest that you err on the side of the larger sensor. I would pick that one because there's a little bit more surface area for them to slide their teeth. Okay. So again, I'm going with large. I've used small before, and either one works for me. Okay, I'm going to slide that up, lock it. In order to take a scan, I have to have two lights, right, lit up. You can probably see it like that. Okay, one light confirms that the handpiece is plugged into the PC, and the other one, the bottom one with the check mark, confirms that I have a sensor inserted and locked into place, and it's all ready to go. Okay, so let's go look at the software now. You can see if I squeeze the sensor with my fingertips, you can see that I have data there. Okay, and I'm going to go ahead and bite on the sensor. And at the bottom of the screen is the sensitivity control. So I'm going to go ahead and bite. All right, and I recommend you have the patient do that first. Okay, just a review for those of you who kind of forgot, the best way to acclimate a patient is let them practice that bite. Bite open until they're relaxed and they're giving you a reproducible bite. It's called conditioning the patient, and we're also conditioning the sensor. Okay, so I'm going to go ahead and go through the sensitivity setting. You can see it's right now, there's 14 levels of sensitivity. I'm at level number 7. You can also control the sensitivity from your handpiece. And the goal is to have 1 to 3 pink contacts when the patient is clenching hard. Okay, that would be when you're just doing a standard, centric occlusion closure. Okay, so I'm gonna go ahead and bite. We'll see what the sensitivity looks like. Okay, and I'm seeing 1 to 3 pinks, so that's good. But just to demonstrate, let me turn this way, way up. Okay, so what we've done is I've turned it up so high, we've over amplified the signal. So the sensitivity is way too high, way too many pinks. And if I go all the way down to the other side to low, I can't even get 1 pink, and I'm biting hard. So for me, the correct setting looks like it's right in the middle. Okay. So for an excursion, I might bump it up. So that was just, I'm setting the sensitivity for just a standard bite, just either a multi-bite scan, clench and release 4 times, or a centric occlusion closure where the patient just bites and releases. So I'm just going to bump it up a couple of, I'll go up to 2 clicks. I'll get a lot more pink, but for the sake of an excursion, as a patient's biting and sliding, it might be helpful just to make the sensor a little bit more sensitive. Okay, so once we've done that, what I would recommend again is you ask the patient to do an excursion, a left lateral. And you all know that you tell them to go left, they go right. So make sure left is left, right is right, and they're doing what you're asking them to do. So set the expectation. So have the patient bite, slide left, open. have them demonstrate it, prove that they understand what you want. Then when you're ready, you convince that they know what they're doing, you're going to introduce the sensor, and we're going to do a left lateral excursion. So we're going to place it in the mouth. Just another note, this is the position guide, that plastic point in the middle. You want to make sure you touch that between the upper central incisors, kind of halfway up the tooth surface, not under the incisal edge. We don't want them biting on that, but we want that to physically touch between the central incisors. So I'm going to go ahead and do that. I'm going to do a bite, slide left and open. Or what I might tell the patient, bite, grind left, open. But you want to tell the patient as they're doing it, bite hard, slide left, open, and you'll tend to get better results. So let's give it a try. Stop the scan. Okay, it says that I have a lot of saturated sense cells, but again, and it says consider lowering the sensitivity. So if you get a high number of pink cells, those are called the saturated cells. Saturation means that those cells, the pink cells, exceed the pressure range of the sensor. But I think we're okay for an excursion. Okay, so we have here a left lateral excursion. The left side of the arch is identified by the green trace in the graph. The right side of the arch is identified by the red trace in the graph. The black trace is the total force. So A to B is the occlusion. This is where I close. I begin the closure at the A line, and you see that correlates to where the black force trace starts to rise off the bottom of the graph. That's when the sensor is starting to detect force. And as I squeeze together, the force rises. And I'll just kind of click in the middle of the bite. So I'm closing between A and B. The force is increasing. You can see the force percentage is right here, 53%. And that 53% comes from where the timeline intersects with the black force trace. So if I'm up here, you're going to be somewhere in the 80% area, and you see I'm at 82% of force. So I close A to B, and then I clench between B and C. So when it's a rising line, you're clenching typically. You're closing or occlusion. When it's a constant steady force, B to C, typically it's clenching. You're holding your teeth together. It's not rising or falling. It's just remaining a constant steady force until the patient starts a movement. And it's the C line is where the excursion begins. And then you can see the black force line drops out as I'm starting to slide, because in order to me to slide, I have to kind of release the forces a little bit in order to slide my teeth. And as I slide to the left side, the green curve, which represents the left side, increases in force. And the red side, or the non-working or balancing side, decreases in force. So you can see it starts to separate. But I don't get a lot of separation here at all, right? You can see where I maintain force on my right balancing side throughout the entire scan. So I don't have anterior guidance, all right? I have group function. It means I'm grinding on my back teeth throughout the entire chewing motion. Not ideal. Part of that is because I'm in the process of having some implants placed, and I have some healing caps right now, and I'm waiting to have the crowns placed. Unfortunately, it didn't happen before today. But we're going to examine a few other scans as well. All right, so I'm going to go and I'm going to label the scan as a left lateral, and then I am going to go ahead and save it. Notice as soon as I click left lateral, we have another feature that just appeared on the screen, and that's called the quadrant view. Okay, and I'm going to turn that off for a moment because we need to discuss that, arch and quadrants. So the standard view splits the arch down the middle between the left side of the arch and the right side of the arch. Okay, as we said earlier, the left side of the arch is represented by the green curve. The right side of the arch is the red curve. So we're seeing left versus right. Now, during the excursion, if you're looking for anterior guidance, not only do we want to get onto the left side, all of our forces on the left side, and complete disclusion on the non-working or balancing side, but we want to be on the anterior working side. So not just the left side, but the anterior left side. This can't tell us that because the way the software is set up right now, it only gives us left versus right. It sees the entire left side of the arch compared to the entire right side of the arch. So in order for us to see left anterior, left posterior, et cetera, we have a feature called Quadrant View. And I'm going to go to View, Arch, and Quadrants. And now we've added two more colors. We still have green and we still have red, but now green represents the anterior left side only. The posterior left side is now represented by the orange line. And you can see there's the orange line. So as I bite together, you see my left side forces are the most forceful, 55% on the left. And again, because I have a couple of implants over here, I have very little occlusion. You can see I have much less force on my right side posterior than my left side. And the anterior teeth, you can see, are touching lighter, which we'd expect that at maximum intercuspation. And then once we get to, so now we can see, not only do I get to my left side, but do I get to the left anterior side? You can see the goal would be on a left lateral to end up with all of the force on the left anterior quadrant right here. I'd like to see this 100%. That would suggest that all the forces are in this quadrant and there is no force on the other three quadrants. Okay, so when we look at this, we see probably a posterior occlusion or a group function where when I slide left, I'm grinding on my back teeth, right? And the definition of anterior guidance is complete and immediate disclusion of the posterior teeth. Okay, so when we can get those back teeth to separate quicker, we can reduce friction-related issues, abfractions, etc. So in my case, I'm not getting that because I could simply look at the graph, follow the green line, because the goal is to get all of the force onto the green quadrant, which is this green. It does start to go in that direction. So I start off pretty well. It's going into that left anterior quadrant. I'm up to 60%. I'll continue playing it. And right here, I get to the peak. But you see the other quadrants, especially it looks like a balancing side interference on 2. You can see it here and there. I have a little bit of, really that's it. I'm mostly on that posterior right side. That's preventing me from having 100% on this side. Okay, I have a very little touch here, 1.5%. So if you took the 1.5% plus the 3.5% plus the 11.5%, and add that to this 83%, you would get 100%. So it always adds up to 100%. Okay, so again, not ideal. I just don't get completely off of that posterior right side. Okay, so now we're going to switch over to a good occlusion, a good anterior excursion. I'm going to switch over to a different patient now. Okay, and let's go to the other patients. And I want to click on show all patients. Here's my list of patients, and we're going to go to Sarah here. And we're going to pick out and you can open multiple scans at the same time. Here's a trick. You'll click on the left lateral excursion. I want to open that. I also want to open the right lateral. So if I hold down my shift key or my control key and click on that, now I'm highlighting 2. And I could highlight all 4 if I want. So I'll click open, and it's going to open both scan 2 and scan 3, both of which are excursions, the left and the right lateral. Okay, and then I'm going to open this because this shows us down the left side, this is the active scans that are open. So I have my scan that we just looked at, and then we have the thumbnail for the first, the scan number 2, which is the left lateral for Sarah, and the right lateral, which is scan number 3 for Sarah. I'm actually going to close this now. No need to save it. Okay, and we're going to look at this one right now. So after we take a scan, you can see the quadrant feature is open. And while I'm on that point, let me just show you that if you want to the Tekscan software to open a quadrant view automatically, we can do that in the settings. So we go to Edit, User Settings. We're going to go up over to Advanced. And then we're going to check off Show All Excursions in Quadrant View. So as soon as you put the label, once you choose a label as an excursion, the software will automatically open that feature for you. So that assumes that every time you look at an excursion, you're probably going to want to use this feature, the quadrant view feature, which I think is pretty wise. So I just want to show you where you can do that. Okay, so we have a quadrant view. Then I'm going to play the movie into the middle where she's biting hard, and she's in complete occlusion, right? She's clenching, and that way I can see all of the contacts around the entire arch from 1 around to 16. The reason I want to do that is I want to move this line, this horizontal line, which separates anterior from posterior teeth. So we want to separate the anterior teeth, canine to canine, from the posterior teeth, first premolars back. And I grab it with my mouse, click, and I can drag up and down. And I want to drop it just above the premolars, 12 and 5. You notice that it is a straight line, so it does sometimes cut through the other tooth. Unfortunately, in this case, the arch is curved, but the line is not. So that's something that we have to kind of deal with. And so once I've determined anterior from posterior, I can now get the 4 quadrants and the goal. What's the goal? Left lateral excursion. To end up on the left side, but not just the left side, the left anterior quadrant, all of the force. So all I need to do is look down to the graph, find the green line. It's running here. It starts here. And then as she's clenched and holding, or a static intercuspation, and then she starts her excursion, and you can see the forces start to rise into the left anterior quadrant, and it jumps right up to 100%. So let's just play the movie. Watch what happens. So here's the excursion. And you see as she slides into the left, the center force kind of follows in that direction. And you see the forces here on the green quadrant. And then right here, they're going to increase. And I'll just pause it when we get to 100%. There it is. There's a canine's tip to tip, forces all the other teeth apart. That's an ideal ending point. Okay, so 100% on the anterior working side quadrant, 0, 0, 0. Other 3 quadrants have discluded. Okay, now let's look at the right side. Okay, now what's the goal on the right side? Get on the red, complete all of the force, 100%. Let's follow the red line. This is the red line, which represents the anterior working side quadrant. Okay, she's clenching and holding her teeth, and then she starts her excursion around the C line, and you can see where everything starts to move again, because now we have movement. So we went from static between B and C to dynamic between C and D, and you see the red line starts to take over. So we have a lot of force early on the posterior right side, but it transfers from the posterior right, and we have equal force here between posterior right and anterior right, and then the right side takes over. And let's play that. Let's just start there, because you can see these forces are kind of similar, 43, 38, whereas 40, 40-ish. So they're similar, right? Where as she's sliding into the right, we're getting similar forces, but then as the canine engages, you see it goes up to 100%, and we know it's going to get there because the graph's telling me that. So I can kind of see in advance that this is going to get to 100%. And there it is, 100% canine to canine, another perfect ending. Is it necessarily perfect through the excursion? Let's have a look. Let's look at the rest of it. So here she's clenching. And you know she's clenching because the center of force stops moving. It just becomes static. It's stuck there. And then when it starts to move, it's kind of in the resting place. Here it starts to move toward the working side that she's sliding into. And the question is, does she get off the back teeth, or does she kind of still engage? So sometimes we get a combination of a group function occlusion and an anterior guidance occlusion. We can have both. So it can be an early group function occlusion, and then it can become later an anterior guidance occlusion. We kind of have that here, but that's a really good ideal ending point. So that's, so again, I just wanted to introduce you to how to take scans, and how to review scans, and kind of give you an idea what we're looking for. Now, keep in mind, as I mentioned earlier, this is a particular philosophy, anterior guidance. And it may not be your philosophy. Some philosophies like to set it up as a group function occlusion, where they want to be on the back teeth. Okay, we're not here to Tekscan isn't here to subscribe to a particular philosophy, but we're here to share. I'm here to share this tool with you to be able to see function and dynamic function. So with that, if there are any questions, please let me know. Let me go over to my slides again. Okay, and on the screen there is, you can see the how to contact us if you need to. Okay. Sorry about that. Okay. Okay, so any questions? And if you, again, you can also take down this information, info@tekscan.com, and feel free to email us anytime and we will get back to you right away. Okay. All right. Well, listen, thank you all very much for joining today. I just want to say to you, have a great day, and feel free to reach out. Oh, so I do have a question. So are you supposed to be only hitting on the canine in the end? Typically in a anterior guidance philosophy, the answer is yes. You want to be, and you could, so anterior guidance, it could be the anterior teeth surrounding it. It could be the lateral incisor, or, but we like to see it on the anterior. Canine to canine would be ideal, but we would still consider it anterior guidance if the forces are being borne on the anterior teeth. You're welcome. Okay, so thank you folks again. We can send you, I think if we automatically send you a copy of this session, if not, we can send you one because we do record the session. So you can have it for review. Again, thank you folks very much and have a great day.